going to look at exercises for IT band syndrome. We're first going to look at what factors you should take into consideration when you choose what exercises you do. Then we're going to look at glute strengthening exercises. We'll look at foot and ankle strengthening exercises. We'll touch on stretches, but actually I've made a different video that only focuses on stretches for IT band syndrome, which I'll link to here or in the description of this video. We'll look at exercises that teaches you good landing mechanics, because how your legs move is quite important for IT band syndrome. And lastly, we'll look at running retraining and why that's an important component of the exercise you do. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want to link to our website. Now, you may think that there is like one lot of exercises you should be doing when you have ITB syndrome. But actually, IT band syndrome can be caused by several different factors. And you can strengthen your glutes until the cows come home. It will make no difference if that wasn't part of the cause for your case of IT band syndrome. So make sure you figure out what your cause was. Because it can either be that you had weak glutes that allowed the pelvis to drop or the knee to turn in too much that contributed to it. It can be that your foot rolls in too much, you overpronate, so strengthening up the ankle or even using orthotics might be useful. Then it can be that you just have really poor mechanics when you land in your sport or when you run, and that specifically has to be addressed. But then also, it can be that actually you have no weakness. It wasn't muscle weakness or control that caused this issue for you. It was a training error. Or it was that you were running on the same side of the road, too much of a camber the whole time. So have a look at the previous video I made where I discussed what the IT band is and all the different causes and the treatments for it, because you may find some advice in there that can be useful as well. But now, if you've established that strength training is the way to go, you definitely need some of that. The other factors you've got to take into consideration is how sensitive is your injury at this point and how irritable is it? Because if it's really sensitive and easy to irritate, you want to restrict what exercises you do at the start. Because remember, the IT band compresses most when your knee goes through that first 30 degrees of knee flexion and extension. So if you choose an exercise to strengthen your glutes that repetitively flexes your knee past 30 degrees, you'll likely just go and flare it up. Or if you choose an exercise like a single leg squat, for instance, and you've not done the work to get your stability there, or it's just not strong enough, or it's too sensitive to load it like that, it can flare it up. So it's really important to choose the correct exercise for your stage of healing. Now, I will point out and demonstrate some of the exercises I find useful for those early stages when the IT band is really still irritated. Then lastly, the exercises you do and the volume of it or the intensity of it very much depends on your type of sport, as well as what level of activity you want to be getting back to. So what are your goals? Because for instance, if you're just a long distance walker and you've got IT band pain, your exercise doesn't have to be that intense or the same as somebody who does a lot of jumping or running in their sport. Also, if you are a long distance runner, you're going to need a lot more endurance in your muscles than somebody who just wants to jog a 5K. If you just want to jog a 5K and you've got IT band syndrome because from just doing very low volumes of sport, it likely means that you just lacked a general sense of control and general muscle strength. And we won't necessarily have to strengthen you up to the same heavy level as somebody who does large volumes of sport. So that's important as well. If we look at glute strengthening exercises first, what the research is showing is that they may be useful, but actually there's not very strong evidence to suggest that they are definitely should be part of your rehab, because we don't have really strong randomized controlled trials yet that shows that they work. The trials we have didn't have control groups in them, so we can't totally say that the changes we saw was definitely because of the exercises. What I will say is if your physio assessed you and saw that actually your glutes are weak, or when you run, your pelvis drops excessively or your knee turns in excessively as you're running, then it may be worth actually strengthening these muscles. Now, your choice of exercise, like I said before, will depend on how sensitive it is, and it's usually best to start with exercises that does not take the knee through that repetitive range of bend and straighten. And good starter exercises for the glutes are things like, I should say beforehand, it's not just the glute med you want to be strengthening, because everybody always focuses on that, but your glute max actually also attaches into your IT band and plays a big part in providing stability around the hip joint. So you want to be strengthening both your glute med as well as your glute max. Good news is, most of the exercises, when they look at what muscles work when you do specific glute exercises, all the glute muscles gets activated. So there's no one exercise that will definitely just strengthen the glute med and just strengthen the glute max. You can get it all in there. My favorite 3 exercises to start people off if they have still got a very sensitive IT band is, first of all, a clam. Now, I know people don't really rate clams that much because they don't resemble anything you do when you run, or they're very low load. But don't, what's the word I'm looking for? They can be useful, basically. Don't discard them is what I wanted to say. For the reason that, first of all, if you saw that your leg was turning in too much, a clam teaches you how to use your hip muscles to actually turn it out. So it's a very good exercise at the beginning to just teach you how to use your bum muscles to actually do that movement. Second of all, there are only so many exercises that you can isolate the glute and the glute max with that doesn't load the legs. So you are a little bit stuck at this point for what choice of exercise you want to be doing. You can do it without weights or without a band, but you can also add a resistance band, and I'll show you in a minute how to do that to increase the resistance if you find them too easy. Then the second exercise is a side leg lift. And again, it targets more the glute med, that one, but also uses the glute max. And it's again a very simple exercise that can just give you a bit of endurance. And if you find it too easy, you add an ankle weight to it, or you can try doing it with a band around your legs. And then the last one is an isometric bridge. I choose an isometric bridge because for some of my patients, if they go up, down in the regular bridge, then it can irritate the IT band if it's still very annoyed with life. If it doesn't, then feel free to go up, down. But I prefer to start with the isometric one at the start. So I'll demonstrate them all for you in the next clip. The clam is a really simple exercise to do, but if you concentrate and do it properly, you can actually get a lot from it. So it can teach you good pelvic stability, how to move your leg without affecting your pelvis, and it helps with core control, and then of course it strengthens as well. So here are the things you want to be looking at. You want to just lie on your side, nice and supported, in a comfortable position. And your knees are bent to about 45 degrees, so they're not all the way back and they're not too straight, they're just slightly bent. And the same thing for the hips. You don't have to get it perfect, you just don't want it up there. You want it a little bit more there to get the best out of it. Then, as I'm lifting up, I'm thinking of tightening up my tummy muscles so I don't roll back. So I am isolating the movement and just using my bum to do the movement. Now, some people may be able to open it all the way up. If I try to force it there, I've actually got to turn my body because my hip's natural range of motion is not that big. It only has that range of motion. So you tighten up, take it out and slowly back down. And remember, the slower you bring it down, the harder it is. And you want to see if you can do about 3 sets of 15 of these. If you can't get to 3 sets of 15, actually you lack a bit of endurance here, and you can do with doing this exercise more regularly. Now, if you found it really way too easy, you can add an exercise band. Just check, because if you're going to put the band across the part that's painful, you're going to make your pain worse. So you want to put it above that area, and if you ensure that the band is flat rather than scrunched up, that's also going to be more comfortable for you. So let me get this on there. There we go. So I want it nice and high, and I want it flat if it will stay flat. There we go. And we just do the same thing. So tightening this to make sure that it's my bum doing the work and not actually me just rolling back. The side leg lift exercise is another one that's really easy to do, but a lot of people probably don't get the best out of it because they don't look at what position their body is in. So let me give you some pointers. The first is you want your upper body in a nice straight line. Then your lower leg stays bent, it gives you a bit of stability, and top leg is extended. But now, if you look down towards your toes, how much of your foot can you see? If you can see your whole foot, it means your legs drifted forwards. And actually when you train it, you're going to be training the outside of your, what's this muscle called? Your quads more, or you'll feel this part working more rather than your glutes. So in a straight line, keep taking your leg back, and you'll notice I'm not moving in this part. I'm moving from my hip. So I'm tightening up this, just contracting my bum to get it down, until you can just see the tips of your toes. So I'm not extending my back to do that. I'm taking it back with my bum. And that's the position you want to be going up and down in. And you may even find that you can't drop it all the way down when it's in that position. And that's totally fine as well. You don't have to be able to drop it all the way down. So that's where you want to be doing your side leg lifts, not right here at the front where it's actually easy. Okay, so make sure you get it back there. And again, we're looking for about 3 sets of 15. Then you know you've got a good basic endurance on both sides. Because this is a low load exercise, you should be able to do quite a few of them. Just remember to give yourself enough rest or recovery time between the sets. You can't expect it to work straight after each other. You've got to rest at least 1 minute to 2 minutes between each set of exercises. And if you're doing all of these in one go, you've got to give it a 2 to 3 minute rest between different exercises as well. Otherwise, the poor muscles won't be able to do them. For the bridge exercise, I'm going to show you the version with a band around my legs, purely because it gets your glutes a bit more active, so you get more bang for your buck. But remember, like I said with the previous one, you don't want to put the band over the bit that's painful. You want to bring it higher up, and if you can try and get the band to be flat rather than in a bundle, it'll be more comfortable. Now, let's see if I can gently bring it on without scrunching it up, because it often annoys me and does that. Okay, so to save time, I'm not going to have a fight with the band now, but you may want to make it so that it's nice and flat, that you don't have point pressure. You want it quite high up. What you do is you're going to separate your knees just ever so slightly. So I'm not taking them further than hip distance. It's just hip distance apart. And then you tighten up your tummy and you think about squeezing with your bum to take you up there. So I'm squeezing my bum and getting me up there. Now in this position, I don't want to be feeling pain on my knee. If you're feeling pain in your knee, you've got to check if you change your position that your feet are in. So the angle of your knees will make a difference. So perhaps bring them a bit closer and see if that's more comfortable. And you come there. Now often people will do a bridge by pushing all the way up as high as they can. That's not really needed, because all you're doing is you're straining with your lower back and you may end up getting back pain. So you just want to think about squeezing your bum and getting you up there with your hips. And just, that's my natural stop. I can't go further. My hips are in extension. You don't want to be feeling it in your lower back. Now at this point, check, are your knees still pointing forwards? If the band has pulled them in, make sure you adjust it and you keep it out there. And then you hold the position. If it's easy, you can hold it for about 30 to 40 seconds. If you're new to this exercise, 10-second repetitions. Rest 10 seconds. Go back up for 10 seconds. See what works for you. If you're fitter and stronger, longer holds, but give it longer rest as well. How can strengthening the foot and the ankle help with Iliotibial syndrome or knee pain? Simply because if your foot turns in excessively, overpronates, remember pronation is a normal part of our running gait, but if it does that excessively, or sometimes it's just about how fast or uncontrolled that movement happens, then that can actually cause your leg to turn in, which again strains the IT band because it attaches to the side of the knee. So if you can provide a bit more stability to the ankle and reduce the speed or get better control over your ankle as you run, that can help reduce the strain of the IT band. So we're looking again, when we think of starter exercises for this, for exercises that doesn't actually involve you standing on your legs. And to be honest, I find these exercises are a useful place to start for everybody, because a lot of people don't actually understand how to properly activate or get those correct muscles to work. So my favorite one is just gathering a towel with your toes, because it gets all the tiny little muscles inside the foot working. You may find that your foot cramps if it's not used to it. It just means you're trying too hard and it's getting too tired. So just be gentle with it. The second one is if you strengthen the tib ant and tib post that comes on the inside of the ankle, they help to turn the foot in this direction and is meant to slow pronation down. And I'll show you in a minute how to do that with a band. Once you've done those two simple exercises and you're really good with it and your IT band has recovered a bit, then you can go on to exercises like balancing exercises. But also, if you just do simple exercises like squats and you concentrate on your foot position and controlling it and not allowing it to roll in, especially when you get single leg squats eventually, that's a really good ankle exercise. So whenever you're doing any other exercise in your routine, look at what your ankle is doing. So for the towel gather exercise, you obviously need a towel and you need a foot. And you're sitting down, and all you do is you grab the towel with your toes. And can you see, as I'm doing that, how it's rounding my arch because it's contracting all the little muscles that's in there. And usually if you do about 20 and then switch feet and do the other side while you rest that one. And if you find it too easy, then you can even add a weight to the towel that you're pulling closer as you're doing it. But yes, it's a nice exercise to just get the feet going and get those muscles activated. To strengthen the tib post, you just attach a band to the front of your foot. Now I've wrapped it twice because then it stays in place better, and I've also put a sock on because otherwise it slips off more easily. If you try to do this exercise and it keeps on slipping off, just put some trainers on, running shoes, so that you put it through the laces. That can help to keep it in place. You attach it securely to something that won't move if you pull on it. And then the action you want to do is just to turn your foot in and slowly control it back out. So turn it in, and then slowly control it back out. And getting the control over that slow return against resistance is as important as the pulling action. You want to use a band that makes you tired within 12 to 15 repetitions. If you feel that you can keep on going past that, your band's too easy. You need to make it a little bit harder, but just check at the start. In the previous video I did about the causes of IT band syndrome, I told you about how it's made of thick fascia and it can't really be stretched, but that there are lots of different muscles that attaches onto the IT band that can be stretched, and if they're too tight or too in tone, they can make the IT band feel really tight. So the muscles involved are the glute max, glute med, your TFL, your tensor fasciae latae, as well as your lateral quads, and some of the research studies show that even some of your lateral hamstring may be attaching into there. So you want to be stretching the muscles that attaches onto it rather than the IT band itself. Now, I feel that stretches for IT band syndrome is quite a large topic in itself and needs a video of itself. So I've made a whole video about this, and I'll link here as well as in the description of this video to a video where I demonstrate all of these stretches for you. The interesting thing about movement patterns is that what the research has shown is just because you've put in the work and you've strengthened your glutes, you've strengthened your feet, it doesn't naturally or necessarily improve the pattern you use when you run or walk. So you may see that, or even jump, you may still see that the knees move in more, or when you're on one leg, the pelvis drops more. even though you've got really strong glutes and strong ankles now. What you have to do is you've got to retrain those movement patterns, because they are patterns that you've learned through the years to use. Now, if you're doing a sport where you have to land, so you're doing jumping in it, or you're doing running sports, then doing exercises like plyometrics can be really useful to teach you the landing mechanics. And what you're looking for, I'm not going to jump today because I can't jump at the moment, is you want to see that when you jump and you land specifically, you can take your landing nice and softly. So you're landing on the fronts of the feet first, and then the heels touch down, and you come through the movement, but also you don't want to see your legs turning in excessively. You want them to move pretty much in a straight line with the middle of your foot when you're landing. And especially when you're on one leg and you land on one leg, you don't want to see your pelvis dropping and your knee turning in, or even just one of the two. Sometimes the pelvis can stay straight and just the knee turns in. So that's what you don't want to see. You want to teach yourself good landing mechanics. It's not rocket science. You start with gentle double leg hops and jumps, small ones to teach yourself. And then you can move on to things like squat jumps or jumping down from a step. But yes, like I said, I'm not going to demonstrate them today because I can't jump at the moment. But you can find lots of videos about good technique with that online. Then if we think of running form specifically, even doing the landing mechanic stuff doesn't mean that your landing form, your running form is going to improve necessarily. You've got to use specific cues to correct the elements of your running form that needs correcting. Now, I've made a whole video about the tips on how you can do this, but the things you want to look out for is if you've got quite a low cadence, so how many steps you give per minute, overstriding, or you run with a narrow gait. And I'll put the link to the video about running and ITB syndrome in the description of this video for you to go have a look at that, because you've got to think about what you're doing while you're running to help correct those elements. Excellent. Hope you found this useful. Make sure that you check out the videos about stretches as well as running style, as well as the causes for ITB syndrome. And remember, if you need more help with an injury, you're welcome to consult one of the team via video call. Link to the website is in the description of this video. Take care.